Okay, so what's the best answer to an interview question that's an ethical question? In this case, it's breaking a hard diagnosis to a 12-year-old child. Do you involve the parents? Do you just talk to the kid? The parents don't want you to break the diagnosis to them. That's the ethical question. And this is from a mock interview that I posted, a few days ago. So you answer a scenario and an ethical question in the same way that you answer every other scenario and ethical question. And that is, guys, it's not a test question. It's not really a trick question. It doesn't have a right answer. All right. There is no right answer. There kind of isn't a wrong answer. What they're trying to see is if you'll think out loud how you are going to be as a potential provider, right? So the example I always give the people I'm training to do well in their interviews, especially with MMIs, scenario questions, ethical questions, is imagine you have a splitting headache. It's the worst headache in the world. Maybe you're wearing a stupid hat for too long. Who knows? The point is, you come to see your provider, your doctor, your nurse practitioner, your physician assistant, and you have this splitting headache. And the person doesn't even sit down, doesn't even look at you. They say, "Oh, so you have a headache?" And you're like, "Yeah." And they're like, "Okay, yeah, you have a migraine. Take this medicine, go away." Probably feel like crap. You don't feel super good. So that's one scenario. And that's kind of what happens when you answer the question and you just go straight into like, "Oh, I would do X, Y, and Z in this case." You're skipping straight to the end. What I don't want you to do is skip straight to the end. I want you to take 4 simple steps. 1, restate the question, or in some simple way demonstrate your understanding of what you're being asked. 2, and this is the one everyone skips, and this is the most important, ask more questions, either from the proctor, from the interviewer, or just make assumptions or verbalize what you would want to know in the situation. 3, based on that information from step 2, you make at least a couple of possibilities that you could do, preferably 3 things that you could do. And 4, then you say, "I would do X, Y, and Z," okay? Everybody that I mock interview, they always skip to step 4. "Oh, okay, so there's a 12-year-old boy, there's a tough diagnosis, I would do X, Y, and Z. I would talk to the parents about, breaking the diagnosis to the kid, X, Y, and Z, the end." What I would say is, okay, so I have a patient. He's a 12-year-old boy. He has a, X, Y, and Z diagnosis. The parents don't want him to know. So first things first, step 2, I would want to know why the parents are concerned about telling the kids. Do they think that he can't handle the information? Do they not want him to worry? Do they not want to deal with him worrying? Is there something else going on in the family? Like maybe they're in the process of losing a grandparent, in the process of being evicted. There's financial struggles. What is going on in the home? Like, why are the parents even thinking about not telling the child? Also, I would want to know, like, in what condition is the child? Is he overall healthy? Has he been dealing with other similar diagnoses his whole life? Or is he like overall healthy and this was just sprung on him? I would want to know as much information as possible about both sides, both parties, the parents and the child. I'd also want to know about the diagnosis. Like, is it really terminal? What is the prognosis? At what stage is it? What are the treatments available? I would want to know all of that before even thinking about possibilities. And then once I have all that information, then I would think about possibilities. Okay, based on this information, I would, sit down with the parents first alone and talk to them about X, Y, and Z. And then we would make a plan on how we would talk to the child together about X, Y, and Z. And that's step 4. All right, so any scenario, any ethical question, you always want to think out loud. You want to use those 4 steps that I just listed. So I hope that helps. And also check out these vine-ripe tomatoes. They're like little yellow tomatoes, and I'm about to eat one, and it's going to be really good.